Welcome back to West Texas View.
Welcome back to the West Texas View. You've met Dr. Cannon, who is with the School of Nursing for the Texas Tech University Health Science Center. And Dr. Cannon, before we go any further, let's talk about this really wonderful gift that you just received from the Davidson Charitable Foundation.
Yes, the Buddy Davidson Charitable Foundation has been working with the School of Nursing over a number of years. Have actually even funded scholarships in an endowment for our students. And I have to tell you, scholarships are so important and they are so helpful to our students. And
but the Davidson Foundation has been such a partnership.
They have.
From the very beginning with the School of Nursing and with the University Health Science Center.
As we were talking with them, they asked me about areas that we might be interested in funding, that they would be interested in funding. And I talked about something that is becoming almost a byword now, and that's called evidence-based practice. And so they endowed a chair for evidence-based practice. And that wonderful donation dovetails beautifully into something that Tech School of Nursing here in Odessa did in a partnership with Medical Center Hospital, was to establish a center for excellence in evidence-based practice. And so I see the look on your face like, so what is evidence-based practice? Huh?
Tell us.
Okay. Evidence-based practice is using information, data, research. It's giving us evidence to do the things that we do and to know that it's correct. Let me give you an example. Because we used to do things because this is the way I was taught, or this is what we used to do.
This is protocol.
That's right. Long time ago, when if you were diagnosed with an ulcer, they gave you something called a SIPI diet. And the don't ask me how to spell that. The SIPI diet was to give you things like milk and cream and puddings, and they thought that a lot of it was due to stress, and so that's how they treated it. Well, lo and behold, someone discovered that ulcers are caused by a bacterium, and it's treatable by antibiotics. And so they give a combination of antibiotics. So that changed how we practice, because the evidence came forward to us that said,
you're not doing this right.
This isn't right. And so that's the best example I can give of what makes it different, is that somebody discovered that there's a different cause, and therefore the evidence says this is how we need to treat it, not what we did in the past. And so we're seeing that all the time as we get new research data, as we look at quality improvement or quality assurance, things that are happening within our hospitals and clinics, that we see patterns and trends that say to us, ooh, this evidence is different than what we thought, and we need to approach it this way. And so the center looks at projects that can help improve and find the evidence that supports the practice. And so we've embarked on this journey, and when I talked to the Davidson Foundation, I was explaining to them about how important that is. And when you establish a chair, it allows you to be able to put someone in that position as a faculty person who has the experience and the expertise to really focus on that and to really delve into it and make changes and make a difference. And so by the establishment of this wonderful endowed chair in evidence-based practice, it will allow us to have a faculty person in that role who can really take a look at evidence-based practice and how that can change what it is that we're doing here in the Permian Basin. And hopefully will actually change what happens in the state and the nation. Because one of the things with the endowed chair is that those people go out and tell the world about it. So it puts us on the map.
That's right. And it helps you in this cycle
That's
to
right.
attract
Faculty.
the top faculty, which then enables you to enlarge your program of nurses,
True.
Nursing students.
And you know, when we talked about the nursing shortage, there are so many different entry levels into nursing. And there are some national trends that are happening right now that are going to impact nursing across the United States. In 2010 and 2011, we had some reports that came out. And one of the things that the Institute for Medicine and the Robert Wood Johnson Foundation did the future direction of nursing, take a look at where do we need to go. And one of the things that they looked at in particular was that we need to have our nurses prepared at the highest level possible. So they're promoting that by 2020, that 80% of the nurses should be baccalaureate prepared.
Wow.
And so that's really important for our community. Right now, Odessa College, Howard College, Midland College feed right into our program. We partner with them in many different areas. We work with them very closely to help the nurses that graduate from their associate degree program get their baccalaureate degree. And so that helps us with that. Then we move them on from the baccalaureate to the master's to hopefully to a doctorate in nursing practice. So we have a wide span. We also have just started a traditional undergraduate program about 2 years ago, about 2.5, 3 years ago, and so that we could help to meet the demand that we're going to have here in the Permian Basin.
And the interesting thing is you have satellite campuses in Abilene.
Yes, there's a regional campus in Abilene, one in El Paso, and of course in Lubbock. We do have students from all over the state that come, and we're looking at ways that we can service those students as well.
But the other thing is this this rural health grant is for here, but you share this information with all these other schools. So really it's a good bang for the buck, and I want us to talk. I'm asking you to come back next Sunday for us to continue this conversation because we've barely scratched the surface. And I want us to talk more about how important that the Davidson Charitable Foundation grant is, and it's only through things like this that you can continue in this field of excellence and to do all of these research projects and attract more students and faculty. So I certainly want us to do that. But one of the other things that I want us to talk about next week is the gaps in the nursing force, and that means that, you know, are we overloaded in LVNs and we need more? I mean, I don't know those kinds of questions, but I've heard some of the things. So we're going to have to ask her to come back next week. This has been very interesting information, and particularly any of you who want to come back to school or who have people in your family that would like to start a nursing program, then you need to get in touch with one of the colleges about this. And the number rolling across the screen is a great place to start. We'll see you next Sunday with another program. Thanks for joining us today.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.